Constipation on Ozempic can sound like a small side effect until the pattern changes. The danger is not one missed bowel movement. It is constipation with worsening belly pain, vomiting, swelling, bleeding, or no gas passing. Mild constipation can often be managed early. Severe symptoms need a doctor fast, especially after a dose increase or a sudden drop in food, fluids, or activity. Many people assume the drug is directly injuring the bowel. Usually, that is not the first explanation. Ozempic, semaglutide, often causes constipation through slower digestion and changed daily habits. The key is to separate expected slowing from warning signs that suggest something more serious. That does not make constipation harmless. It means the first question is pattern, not panic. Use this as a safety map, not a personal treatment plan. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. Ozempic works through a gut hormone pathway that affects appetite and digestion. It can make you feel full sooner. It can also slow the timing between eating, stomach emptying, and bowel movement. Less food, less fluid, and slower timing can turn normal stool into hard stool. The first thing to check is your new daily pattern. Many people eat smaller meals on Ozempic. Smaller meals can mean less stool volume. A lower appetite can also mean fewer vegetables, fewer regular bathroom cues, and less movement after meals. Fiber means plant material that holds water and adds stool bulk. It helps many people, but it works best with enough fluid. If someone adds a lot of fiber while drinking very little, bloating may worsen. Slow changes are safer than dramatic corrections. The weight loss diet around the drug can also matter, and overall food pattern matters too. Some people cut breakfast, fruit, beans, and whole grains at the same time. High protein with very low plant intake can make stool harder for many people. Bathroom rhythm can also change quietly. A person may skip meals, sit longer during the day, and ignore the first urge. By the time stool feels stuck, several small changes have already combined. Before judging constipation, know your baseline. Some people normally go twice a day, others go every other day and feel fine. A meaningful change is slower than your normal, harder than usual, or paired with new pain. After the daily pattern is clear, the drug label explains why symptoms still deserve respect. The official drug label lists constipation among common reactions. It also lists later safety reports of bowel movement stopping, bowel blockage, and severe constipation, with hard stool stuck inside. Those safety reports do not tell us exactly how often this happens. They do tell us which symptoms should change the plan. Do not panic over one slow day. Do not call severe constipation normal just because stomach side effects are expected. Dangerous constipation can look ordinary at first. A person waits, strains harder, eats more fiber, and takes repeated laxatives. Meanwhile, the abdomen gets more swollen, pain becomes constant, and gas stops passing. That pattern should not be treated like routine bathroom trouble. Risk is higher when several risk factors happen at the same time. Older adults and people who already had constipation may struggle more. Strong opioid pain medicines can slow the bowel. Iron tablets, calcium supplements, some bladder medicines, and allergy medicines called antihistamines can also slow stool. New constipation after a dose increase deserves more attention. Dehydration can hide behind normal daily routines. Dry mouth, dizziness, dark urine, or much less urination can matter in hot weather. These signs do not prove a bowel problem by themselves. They do mean constipation is happening in a less safe setting. Prevention starts before the problem becomes dramatic. Drink regularly, especially if appetite is low. Add fiber slowly through food, not as a sudden punishment. Walk after meals when you can, and keep a simple stool log during dose changes. A useful stool log is not complicated. Write the date, stool hardness, straining, pain, vomiting, and whether gas passed. This helps your doctor see whether the problem is improving, staying stuck, or moving toward warning signs. It is especially useful during travel, illness, or dose changes. Many viewers want one exact number of days. Medicine rarely works that cleanly. 3 days without stool may be acceptable for one person and concerning for another. 7 days is too long for most people, especially with pain, vomiting, or no gas. Use 3 levels to decide what to do. Mild constipation means hard stools, straining, or fewer bowel movements, but no severe pain and no vomiting. Persistent constipation means symptoms continue despite reasonable self-care, or return every week. Red flag constipation means severe symptoms, not just slow bowel habits. Mild constipation usually starts with hydration, gentle walking, and gradual fiber. Do not make 5 changes on the same day. Persistent constipation is different. Your doctor may adjust the dose schedule, review other constipating medicines, or suggest a short-term laxative. Polyethylene glycol is an osmotic laxative, meaning it pulls water into stool. Stool softeners make stool easier to pass. Stimulant laxatives push the bowel to move. Suppositories are medicines placed in the rectum. These options are not interchangeable when pain or swelling is present. Ask your clinician or pharmacist before using several constipation products together. This matters especially with kidney disease, heart disease, or several daily medicines. Combining laxatives without guidance can cause dehydration, cramps, or confusion about which product caused a new symptom. Red flag constipation needs a different mindset. Do not keep pushing fiber, stimulant laxatives, or rectal fluid treatments called enemas without medical advice. If stool cannot move, forcing the system may make pain and swelling worse. Call your doctor promptly if constipation is new, worsening, or lasting longer than your usual pattern. Call sooner if you recently increased the dose, stopped eating well, or feel weak from poor intake. Do not wait until pain is severe, because earlier contact leaves more room for simple options. When you call, give concrete details. Say the last bowel movement, whether you passed gas, and whether pain is constant or cramping. Mention vomiting, fever, bleeding, new medicines, dose changes, fluid intake, and recent laxative use. Also mention any prior bowel surgery or a history of bowel blockage, if any. Your doctor is not only deciding whether you need a laxative, they are deciding whether constipation matches a drug side effect, dehydration, another medicine, or something unrelated. Red flags may require an exam, blood tests, or medical pictures or scans. Seek urgent care if constipation comes with severe belly pain or repeated vomiting. A fever, swollen hard abdomen, or inability to pass gas also needs urgent care. Rectal bleeding, black stool, confusion, fainting, or severe dehydration also needs fast evaluation. These signs can point beyond simple constipation. If your situation is not urgent, do not stop Ozempic by yourself unless your clinician told you to stop. But do not increase the next dose while constipation is worsening. If you are already struggling at the current dose, escalation can make the timing problem harder. Call your prescriber before the next dose. Ozempic constipation is common enough that it should not surprise you. It is also serious enough that you should not minimize red flags. Track pattern change, pain, vomiting, swelling, bleeding, gas, hydration, and dose changes. The danger is not constipation itself. The danger is missing the pattern that says it is no longer simple. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.